ಇಂದೇ ನೀ ನಿರ್ಣಯಿಸಬೇಕು, ಇಂದೇ ಎತ್ತಿ ಪೊರೆಯಬೇಕು. ಬೆಂಕಿಗೆ ಬಿದ್ದವರನ್ನು ನಾಳೆ ಎತ್ತುತ್ತೇನೆಂದರೆ ದೊರೆಯುವುದೇನು? ಬೂದಿಯಲ್ಲವೇ? ನೀರಿಗೆ ಬಿದ್ದವರನ್ನು ನಾಳೆ ಎತ್ತುತ್ತೇನೆಂದರೆ ಲಭಿಸುವುದೇನು? ಹೆಣವಲ್ಲವೇ? ಇದು ನಮ್ಮ ಮಹಾನ್ ಕವಿ ಕುವೆಂಪು ಅವರ ಮಾತುಗಳು. ಇದು ಅಂದಿಗೂ ಪ್ರಸ್ತುತವಾಗಿತ್ತು, ಇಂದಿಗೂ ಪ್ರಸ್ತುತ, ಇಂದಿನ ಈ ವಿಷಯಕ್ಕೂ ಸತ್ಯವೇ ಹೌದು. ಸೊ ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. HPV ಮತ್ತು ಕ್ಯಾನ್ಸರನ್ನು ಹತ್ತಿಕ್ಕೂ ಒಂದು ಸಮಾವೇಶ, ಕಾಂಕರ್ HPV ಆ್ಯಂಡ್ ಕ್ಯಾನ್ಸರ್ ಎ ಕಾನ್ಕ್ಲೇವ್. ತಮ್ಮೆಲ್ಲರಿಗೂ HPV ಮತ್ತು HPV ಸಂಬಂಧಿತ ಕ್ಯಾನ್ಸರ್ ಹರಡುವಿಕೆ ಮತ್ತು ತಡೆಗಟ್ಟುವಿಕೆಯ ಸಮಾವೇಶಕ್ಕೆ ಆದರದ ಸ್ವಾಗತ. We cordially welcome you all for a program on HPV and related cancer prevalence and protection. ಇಂದಿನ ನಮ್ಮ ಸಮಾವೇಶಕ್ಕೆ ಆಗಮಿಸಿರುವ ನಮ್ಮ ತಜ್ಞರ ಸಮಿತಿಗೆ ಪ್ರೀತಿಯ ವಂದನೆಗಳು ಮತ್ತು ಭವ್ಯ ಸ್ವಾಗತ. I cordially welcome the expert panel for the conclave. Thank you very much, doctors, for being here. ಈ ಸಮಾವೇಶಕ್ಕೆ ಆಗಮಿಸಿರುವ ಎಲ್ಲ ಮಾಧ್ಯಮ ಮಿತ್ರರಿಗೂ ನಮ್ಮ ವಂದನೆಗಳು ಮತ್ತು ಪ್ರೀತಿಯ ಸ್ವಾಗತ. I also cordially welcome the media friends present here for the conclave. Thank you very much for being here. ಮತ್ತು ಇಲ್ಲಿ ಆಗಮಿಸಿರುವ ನಮ್ಮ ಎಲ್ಲ ಅತಿಥಿಗಳಿಗೂ ಹೃತ್ಪೂರ್ವಕ ವಂದನೆಗಳು ಮತ್ತು ಆದರದ ಸ್ವಾಗತ. I also cordially welcome all our distinguished guests present for today's exciting conclave. Thank you all. So I take this opportunity to welcome and introduce today's moderator for the program, Dr. Bhaskar Shenoy.
First of all, let me thank Serum Institute for organizing this excellent symposium, awareness program to give the awareness about the HPV and related cancers. How do we prevent it? It is not a promotional activity. In fact, it is an activity to create the awareness among the public through the medical professionals and through the media. And it is an excellent initiative in combating the dreaded cancers like cervical cancer. And we are trying to align with the WHO strategy, WHO recommendation to conquer the cancer in the near future. With that introduction, I have an extremely learned panel of specialists who can throw more light on the HPV and the cervical cancer. We have a balanced team of pediatricians and the gynecologists. Let me first call upon the panel of experts, Dr. Chidananda, a close friend of mine. He is the consultant pediatrician in Bangalore. He was the secretary of Indian Academy of Pediatrics, Bangalore, and Indian Academy of Pediatrics Infectious Disease Chapter of Karnataka. Now, next I call upon Dr. Prashant M.V., who is a consultant pediatrician and a neonatologist. So, with the support of these excellent panelists, I think my job is made easy today. So, first of all, to introduce the topic, let us understand what we are standing here for. Let us first try to understand what is HPV. Human papilloma virus. HPV stands for human papilloma virus, and it is a common sexually transmitted infection. And there are over 100 types of viruses, out of which maybe around 12 types are more common. They are called as oncogenic strains. They cause cancers, especially the cervical cancer. They can cause warts, genital warts, anal warts, or even what is called as a recurrent respiratory papillomatosis. So these are the few things. Out of those 12 which I mentioned, the type 16 and 18 are more commonly known to be associated with cervical cancer. And these, as you know, these are transmitted by skin to skin contact, especially during the sexual activity. People may ask, what is the relation between the HPV? It is a virus. What is the relation between the virus and this cancer? So this HPV is responsible for nearly 90 plus or 99% of the cervical cancer in the females. And it is also linked to some other cancers like maybe cancer of the vagina and vulva, cancer of the anal or penile cancer, even cancer of oropharynx. So it is not that this HPV causes only the cervical cancer. It can be responsible for many other cancers. You may ask, who are the people who are at risk of this cancer? Every one of us are at risk. It is not that somebody who is, if you look at the amount of infection that has, most of the people, most of the adult people will have this infection. It affects both males and females. But the peak age of this affection is between 15 to 25 years. And it is high prevalent in young adults. And especially those who are sexually active. The sexual activity may be of any type. It may be oral, anal, or direct penetrative sex. People may ask, if I use condom, can I bring down the HPV infection? To some extent, yes, but not 100% protective. Condoms are not 100% protective in preventing the HPV infection. Remember, most infections, they occur, clears naturally. People may ask, if I get a HPV infection, will all of them who get HPV infection develop cancer? No. About 90% of them, in them, this infection will persist for a longer time, and after some time it may wane off and it may disappear. But it is those 10% in whom it persists, in whom it causes early symptoms of cancer. They are the people we are trying to target, both by screening or trying to prevent by vaccination. So it is not that moment you get HPV infection, you are trying to, all of you will get cancer. It's not like that. But in those people where it persists and it mutates and it becomes cancerous, those are the people. And then there are questions which we come across. HPV is mostly in females. Is it also in males? How it manifests in females? So if you look at the statistics, it is said that 80% of the women will have get infected with the HPV at some point of their life. 80%. And as I told in the initial period, India accounts for about 1/4 of the global burden of the cervical cancer. And cervical cancer, as you know, is the second highest number of second place in the cancer, first being the breast cancer. If you look at the statistics, around 77,000 deaths occur annually, and more than 1.5 lakhs of infections, they occur every year. The cancers occur every year. And what is the reason for the high incidence? If you look at the global burden, India contributes to around 1/3 of the total cancers of the world. Why? There are various reasons. One is the awareness. The awareness among the public is very less, because they think that you get the viral infection today and the disease starts after so many years. So should I be preventing that with the vaccine? That is one thing. Second thing, there are so many myths surrounding this, and whether there is a vaccine to prevent the cancer, really most of them may not know. And the screening, which gynecologist colleagues will definitely agree with me, the screening mechanism in India is dismally poor. Though there is a screening method, there is no methodology or a properly done method of screening routinely for all the females who attain certain age, maybe 35 or 30 or 40, whatever it is. That system is not there. Here and there we do screen who come to a private practitioner, but there is no uniformly nationally available screening method in India. And that is responsible for these cancers becoming more severe, and they are detected only when there is nothing can be done. At that stage it is being detected. The screening program is to detect them early before it spreads to other parts, before it becomes severe. So the poor awareness among the public is one of the important things. And now it is the responsibility of we medical professionals and the media to convey this to the public so that the awareness about the HPV, awareness about the cervical cancer.
Urban population. Of course, rural it is very, very less. I don't have to mention. I just want to mention the importance of HPV vaccine in this, because that's a question. In 2008, there was a Nobel Prize which was shared by two people. That changed the thought process on virology in humans. Especially in 2008, Professor Harold, who described that HPV virus caused cervical cancer, received a Nobel Prize for this. And look at the importance. Even after 16 to 18 years, we are sitting and discussing on the same subject. A person received a Nobel Prize 15 years back. That Nobel Prize was shared by one other team of professor from Germany who defined HIV virus in total. So such a major discovery is received Nobel Prize, and we still have struggling to accept HPV vaccine as a good vaccine, as an acceptable vaccine even after 18 years. I think we'll have to move ahead, and as a learned personnel, doctors, practitioners, obstetricians, we have to think in a positive way. This itself received a Nobel Prize in 2008 when he said HPV virus caused cervical cancer.
See, vaccines we give from the infancy, from the immediately after birth, BCG, polio, jaundice, all that. I think so it has extended the schedule up to 15 years, I think now presently. After this HPV vaccination, it is included in the immunization protocol book now. Everybody has printed that immunization protocol. Non-acceptance because cancer, everybody are not knowing that cancer can be prevented. No, it is, they think that by the evil this thing or whatever God's desire to get a cancer, so we had to suffer with the cancer. That's what the people they think, so many people they think that is not a preventable thing. So what we are blessed or it's from the God only, so we should suffer. But now, when the scenario has changed also, they are not accepting. Oh, there is a vaccine? So you believe me or not, when I did this vaccination study, if you can permit me, that time they were asking, that time COVID was rampant. This vaccine study was there, which has started in 2018. 12 tertiary care hospitals all over India have participated. Delhi, Pune, Ahmedabad, Bangalore, I was the one. I was working in MS Ramaya Hospital. It was September 2018. 2019 was the COVID. Rampantly it was there. 19, 20, 21. But still, I perceived to do this study, sir, with difficulty. And they were questioning me, what are you giving? What vaccine you are giving? Is it for cancer or something like COVID? Like that they were questioning. But with the difficulties, with the good video recording, I had a good video recording display. For half an hour, I had to explain. As I did the study, 9 to 25 years, both boys and girls. It is all over India. It is 2,317. That is 9 to 15 years, 1,117 were there. In that, the 800 were girls and 350 were boys. And 15 to 26, another 800 were there and 300 were boys. So in this study, so they were not accepting. It was a great task for me. I am a practitioner. I was a in and out gynec practitioner, obstetric practitioner. I have done 34 to present date. I am having a 34 years of experience in obstetric practice. So I do have a patient. Patient believe me. So they believed me a lot. Like that, I could enroll them, all of them, in my study, and I could vaccinate perfectly. Actually, the Serum Institute were saying, you do some more. You take a taxi, go to their houses, give them vaccine. Like that, they gave me this thing, and I will reward them. So like that, I completed
Correct.
my study.
Madam has brought out a very nice point.
But I will take it as a continuity of the discussion which has been happening. So when we are looking at such a low rate of vaccination, what are the barriers? Madam pointed out her thing. But as a pediatrician, what are the barriers that we face? As soon as, we start telling the parents that, you have a 9-year-old, 10-year-old, you have to vaccinate, for the HPV. So apart from the caste, 3 common questions come out. Why so early? You say the disease is coming in, 4th decade, 5th decade. Why, so my child is not even matured, so at 9 years, 10 years, why I have to vaccinate? This is the first question that will come up. Second thing they will, ask is why boys? This question will come because previously this has been promoted as cervical cancer vaccine. So the moment we say even boys have to take, they'll ask why boys? Then, of course, another thing, mainly because of, the WhatsApp university and what other people are telling, immediately what they'll ask, is it going to cause impotency? Is it going to cause infertility? That scare has been there. So it is our duty, to dispel these 3 common myths that the patients are having. So since the specific question is towards the boys, as sir has told, though it is called as cervical cancer, because initially whenever a new vaccine comes, it is always targeted at the high-risk population. COVID, now everybody understands. We can counsel them, telling COVID vaccine when it came first, who was given? So healthcare workers were given. After that only, then the high-risk population, then it was rolled out to everybody. So the same way, because initially when it come, as sir said, we are having short supply and things like that, cost and other barriers were there. Because cervical cancer was the major issue, so the target populations were ladies. Okay, so the girls and ladies that were given. Now since the cost has come down, we are producing vaccine in abundance, it is time that, we are going to increase our coverage because, see, boys, as we told, apart from cervical cancer, it is also going to cause vulval cancer, vaginal cancer, warts, anorectal cancer, oropharyngeal. This is all for girls. Boys have 2 roles to play. One is direct benefit to them, protected against the genital warts. They're going to be protected against the penile cancer, oropharyngeal cancer, anorectal cancer. These are the direct benefits for the boys. Definitely list is less compared to the girls. That list has been put up there. Another important thing is, they are the ones who are going to transmit the disease to their partners. So, by vaccinating the boys, we are reducing the burden of transmission to their partners. So, if the parents have a girl child, they will understand it. You can tell it, it is a gift. By vaccinating your son, you are giving it as a gift to your daughter-in-law. Okay, so you're going to protect her also. So, direct, indirect benefits, both are there.
Vaccinating only females, you are half work done. To do the full work, you vaccinate even the boys also, so that they all are taken into the circle of protection to get the target, to achieve the target of eradicating HPV or reducing the burden of HPV and reducing the burden of cervical cancer. It is not enough only to vaccinate females. You have to vaccinate the source also, because both sides if you do, it is better. So that is the idea. Other points he has very well told. So, are all HPV vaccines licensed by DCGI for boys, Prashant? The one is multinational, one is Indian made. And how is the recommendation for when it comes to the vaccinating boys?
See, the recommendation is the same, 9 years to 14 years, boys and girls, we give 2 doses, 6 months apart. 15 years to 25 years, 3 doses, first and second dose 2 months, and after that is 6 months. So recommendation is the same. So boys and both the sexes recommendation comes with only one quadrivalent vaccine that is made by the Indian company, Make in India project. So I think that has been approved recently for both the sexes, boys and girls. Of course, when it comes to the aggression of vaccination, DCG has approved and Government of India has approved. So it will be given for both boys and girls in the same schedule, in the same way. So that should not lead to any confusion now. It's a very common question asked, should boys get 1 vaccine, should boys get 3 vaccines and all? It's the same schedule.
So you have 2, as I told, 2 brands, trivalent vaccine. There are multinational, 2 brands are there. One is quadrivalent and nonavalent, that is 9-valent. The quadrivalent of Indian company Serum Institute is recommended for boys 9 year onwards. But the quadrivalent of multinational company is not recommended till now for boys. But nonavalent, that 9-valent is recommended for boys. So that point we have to keep in mind. So, madam, do you think HPV vaccines are safe?
Definitely.
Have you seen any side effects of vaccine? If it is seen, what are the common side effects which you
No,
see?
not at all. We have been giving vax till now and nothing, no major side effects. And I mean, most of the questions they ask is related to menstrual cycle,
Correct.
fertility.
Absolutely, absolutely.
And we have seen that it is safe. And whatever it is, maybe some mild redness at the site of injection. Apart from that, mild giddiness is what is anticipated, they say, immediately after injection. So just observe for 10 minutes after injection, make them sit and observe. No major side effects
Absolutely,
at all.
point well taken. It is absolutely a safe vaccine. Tenderness, occasional fever, but I have not seen even fever in many of the cases. That is one thing. The second, yes, madam.
Guillain-Barré syndrome, some had reported, so we are still not
But
very
still
clear.
there is no causal relation between
With the
Guillain-Barré
vaccine,
and
yes,
the vaccine.
vaccine, definitely
For
not.
that, many other vaccines also have been implicated.
Because
It
many
may
of
be-
the educated people, they were worried about
Yeah,
this.
because they look at the social media and then, yeah. So it is absolutely a safe vaccine. It doesn't cause any serious side effects. At the most mild pain or a bit of swelling at the site of injection. Only thing is, as madam told, sometimes they may have the syncopal attack or giddiness, and which subsides on its own. It is mainly because of the anxiety than anything else, because they're little older to understand things compared to other vaccine groups. For that, you have to give the vaccine and make them sit in your clinic, sit for maybe 15 minutes. That will take care of that point. Other than that, there are no reported major side effects.
These are the kind of vaccine like particles are injected here. There's no live antigen, vaccine content. So it does not cause any kind of impotency in both boys or girls.
Correct.
That is one thing which is making the vaccinations easy. They don't have to really concentrate on antibody titers.